Well, thank you for coming again tonight. It is the last session, so we appreciate your attendance. Today I'm going to talk about an in vitro panel that we put together. And I'd first like to mention that we do have a disclosure that this research was funded by the Kenzie Nash Corporation. Now, why are we putting this in vitro panel? So often you see that everyone's developing these natural decellularized surgical meshes, and they're looking at the processes, looking how to retain these bioactive factors, and then they're being implanted. And from a cell biology level, the question for me is, well, what's going on with that initial host reaction? Can we predict from these initial host reactions a better way to apply these surgically, but also can we reverse and look at how we decellularize materials and create a better process? So in terms of the materials we picked out, we looked at a lot of commercially available materials that are on the market. Alloderm gel foam, medium matrix permacol, and stratus. And gel foam was our control, as it is slightly differently processed than most of these other materials. And of course, we followed the instructions as per the manufacturer to make sure we didn't alter these in any way that they would be used in the surgical setting. And although these do vary slightly differently in terms of source and also cross-linking, they are used for very similar applications. Now, the way we broke this down, because looking at from the cellular response aspect, it can be broken down in several different ways. So we really looked at the cues that the materials were giving. And the first section of it is the cell response. And the way we broke this down and considered it is through 3 different assays: proliferation, apoptotic recovery of cells, and metabolism. And with these particular assays, they're all done with conditioned media, which is serum-free, just to elute any of the factors that were residual in the material. I do want to point out, for all of our assays, we actually fine-tuned them and picked out different types of cells that would be very typical response within the body to specific cues. And then the second aspect of this is cell guidance. And when we talk about cell guidance, it's broken down in several different ways as well. So the first 2 assays we included in this panel is a scratch wound assay, which looks at just cell migration in terms of wound closure. And the second one is the chemotactic assay performed in a Boyden chamber. Breaking this down a little bit further, moving from conditioned media, we started to look at the actual structure of the material. First in terms of cell adhesion or attachment to the outside, and the second was an invasion. How far can these cells move into the material through the current architecture? And then the last assay we added to this panel is a little bit slightly different than some of the in vitro work, and it's called a CAM assay. And I'll go over that in the future slide. So beginning with the conditioned media and cell response, the first assay we looked at was actually an apoptotic response. What it really is we're stressing these cells out into this in this environment for 24 hours that's serum-free, and generally cells will go down the death pathway. So after stressing for 24 hours, we added our conditioned media from this material and looked at it 24 hours later. And what we investigated was the caspase 3-7 pathway, and briefly and that's one of the apoptotic pathways that's very common in terms of cell stress. So we looked at it by chemiluminescence and looked at the absorbance. And overall, although while the positive control, the serum, recovered our cells very nicely, we didn't really see any different effect between the different materials statistically. We did see some cells had recovered better with some materials that were conditioned from the conditioned media, but overall there really was no significant difference. In terms of metabolism, this is actually broken down per cell basis, so it's not an overall metabolic view. But after 24 hours of being in the conditioned media from the material, we also did use a culture counter to separate out the cell number and did micrographs and counted these cells individually. And then from there, we're able to run an MTT assay, which is a mitochondrial activity assay, and look at the per cell basis. And again, we really didn't see a difference between the material for the conditioned media, which is a good thing because we know that there is no major effect on the health of these cells, that they are surviving. They just might be performing in slightly different ways. And finally, in terms of the cell response, we looked at proliferation as well. And this is where we started to see slightly different effects. Again, these are 24-hour cultured and conditioned media. And using photomicrographs at time 0 and time 24, we're able to discern different populations of cells that were increasing in in number. You can see here that looking at the meteor matrix and the stratus, they were definitely increasing in terms of culture. And in terms of the other materials, we were starting to see some cell death. It might not be indicative of the metabolic activity of the cell, but we were starting to see some of them go down the apoptotic pathway. Now moving on to more conditioned media and cell guidance. This is kind of getting into slightly different cues. And so often you hear so many bioactive factors that are residual in this material that cause cells to infiltrate into the material. So we want to know, are these actually in fact separate than that of the architecture? So performing your standard scratch wound assay, in which you have a confluent layer of cell and you create a defect across it, and then adding the conditioned media, we can start to see cells will start to migrate and close this wound. And from this assay, we saw that meteor matrix, permacolon, stratus all started to increase the wound healing significantly over our negative control. And the other assay that has also to do with cell guidance is a chemotactic assay. And this is performed in a Boyden chamber where you're going to have a gradient of chemotactic factors underneath, and the cells will actually migrate towards that concentration if in fact they exist. And again, very similar to what we saw for the scratch wound, we saw the meteor matrix, permacolon, stratus did undergo that migration. Even though these appear to be very similar in migratory assays, they actually do have a slightly different effect chemically. Now moving on to attachment and cell guidance. So this is when we're moving from the eluted factors and actually looking at the architecture of the material. Even though if you look at the decellularized material on the gross level, they all look very similar with different collagens. For attachment, it's important for cells often to attach quite readily, otherwise they will apoptose or die immediately. So taking a cell solution and taking different punches of these dermal materials, putting them into a shaking incubator. After 3 hours, we're able to remove these materials, wash them in PBS to make sure there's no excess cells that were kind of just sticking on there, fix them, and then stain them for DAPI, and then look at them under the microscope, approximately 100 microns depth, to see how many cells had attached. And from here, we actually set up a histomorphic metric analysis using image J, and we're able to assess the number of cells based on size exclusion, determine actually how many attached to the surface. And from here, again, we saw meteor matrix and permacol definitely had some of the highest attachment, while stratus was a little bit lower, and gel firm most likely was a little bit lower due to the fact that it's a very porous structure and doesn't have many places for attachment on the surface. And then now in this case, alloderm, even though has a very similar structure to meteor matrix, we saw really poor cell attachments. We knew something was going on the surface. And continuing on with understanding the structure of this material, what we did is it's an invasive assay. So including this in our panel, we're able to take these materials, put them into a cell culture insert, and then seed cells on top of it. And depending on the structure, the cells will actually migrate in and migrate through towards the bottom if it's a very open structure, as we see in gel foam. If you look at the graph, you have a very nice even distribution across the material. Now looking at two similar materials, permacol and stratus, they're very, very dense. And we can see that, yes, although the cells do attach, they just don't migrate in, and the majority of the cells are on the surface. Meteor matrix and alloderm actually are very similar in terms of their open structure, where there is some porosity. So meteor matrix, the cells will start to migrate in, but also there's larger pores, so they can move to the bottom. And while alloderm has a similar structure, most of the cells stayed on top. And one other thing I do want to point out, something we're starting to see patterns with our experiments at this point. And as I mentioned, alloderm had really low attachment. And when you actually get down to the cellular level and looking at the structure and the morphology of the cell, you'll start to see that when it's on these materials, it's not really well attached. This is definitely a little balled up, and it's not really in the nice migratory phase with all these pseudopodia sticking out, compared to what we were seeing with permacol and meteor matrix. Now, getting into the KM assay, I'm not sure how many are familiar with it, but it's actually a great inexpensive in vivo assay that's very easy to run and highly predictive of invasion and angiogenesis. And the way it works is you're working with chick fertilized embryos. So we get their egg shipment at day 1, right after fertilization. You let them incubate for a little bit. And then you actually remove some of the albumin. And by removing some of the albumin, you're creating a space on top of the egg. So you're allowing for the egg to drop and giving yourself a nice work area without having contamination. So then day 4, you go ahead and you can create a window by cutting open the top of the eggshell. And you can see from the bottom pictures, you can see this embryo in there. And we let it sit just to make sure it doesn't go into an abortive process after being exposed to the air. And by day 7, after it has been fertilized, this is when we actually take our material and we put it onto the CAM, the chorioallantoic membrane of the egg. And generally try to avoid any of the large vessels, because what happens is if the material has any angiogenic effect or any factors that it's eluting out, will actually attract the vessels to grow towards it and cause ingrowth. And you can see by day 14, after 7 days of implantation, we're having these large vessels starting to wrap around some of the material, and what you might not be able to pick out from the fine details is all these little micro vessels are starting to grow into the material, and you can kind of see them containing the material. So in terms of results, it was actually really nice to finish our panel with this, because we were able to look back and make a lot of correlations based on what we saw earlier. And again, starting with gel foam, since it's such a highly porous and open structure, it's very evident that, of course, it would be invaginated quickly. And whether or not it's mostly due to the open pore structure, because we really didn't see any of those factors that were eluting out that would suggest that we're having an angiogenic effect. And then in terms of media matrix, this is where we saw, in terms of the invasion, a lot of the cells moving in. It really has that nice open pore structure. And looking back, we're able to actually look at the blood vessels and do a cell count and understand how much vascularity we saw. And finally, for the other two, Permacol and Stratus, again, these were the very dense structures where we wouldn't expect any invasion. Of course, we didn't see any of it. We saw it around the outer surface, but most often it's going to be an enzymatic process. It's going to break down those extracellular matrix and allow for that incorporation into the host. And finally, alloderm, even though it had a very similar structure, as we saw from some of our other studies, architecturally as media matrix, from our earlier conditioned and elution studies, we saw that there was very little infiltration. And most likely there's something going on there that's causing rejection of the invagination of the CAM. So to conclude, we really assembled this in vitro panel to understand what the interaction is on the cellular level and why this is important, because there really is an early tissue response that we don't always get from in vivo studies that occur after harvesting 14 days, months down the road. And also, if we understand what the cell reaction is, can we go back to that process and slightly modify our decellularization process to increase these bioactive factors in maintaining their activity or being retained in the material. And finally, if we understand early on what's going on with this material, can we predict how it will be applicable for surgical applications, and will it allow for a physician to look at it and say, well, this would be better for this application, and because this has a migratory effect, it'll be better for this particular application. So I'd like to conclude by thanking several of our lab members. I'd like to thank Craig Neville, as he's been the mentor on this project, Sophie Liu, who is back in China doing her plastic surgical surgery rotation, and also Kenzie Nash for providing insight on decellularized extracellular matrices. Thank you. Yes.
Hi, Lynn Jones from Johns Hopkins. First of all, I want to compliment you on an incredibly well-presented study, and a study that was done very logically. My question has to do with the alloderm, which almost became a negative control in your study. I run a tissue bank and in a hospital in which we use a lot of alloderm, and those patients do quite well. And I'm trying to figure out what the disconnect is between laboratory studies and what we're seeing with our patients.
That's actually an excellent question, because this is something that we were always wondering about correlation as well. And the one thing I noticed with alloderm compared to these other materials is there's always this residual powder, and especially when you cut into it. And generally when you're pulling these materials out of the package, ready for surgical applications, you're going to use them as is. But for our in vitro studies, we don't need this large sheet, so we would have to punch it into smaller pieces. And with alloderm, every time I punched it, there was this fine powder, and I tried several ways of making sure it was eradicated, and because I found when it sat on, if I left it in the solution, it would sit on top of the cells and cause adverse effects. So it could be either by removing that powder through centrifugation and also filtration. I might be removing something inherent out of the material, or by leaving it, it was also causing this clouded effect on the cells. So I feel alloderms always was this material in the study that I couldn't quite figure out, and I think by doing more early in vivo studies, it might give us more an idea if it's just an early reaction that is being diluted out by the body that we don't see, which often occurs in sites of surgical implantation, or if it just manages to repair itself later on. So.
Thank you.
Thank you.